All right, welcome to In Motion Falls Prevention, a better everyday trademark program for people living with Parkinson's disease. Many fall prevention strategies call for the person with Parkinson's or the PWP to change their behaviors by knowing the facts about falls, focusing on self-help, utilizing medical support, and developing safety in the home. Behavior change is seen as a dynamic process involving both cognition and behavior that moves a person from being uninterested, unaware, or unwilling to make change to considering change, deciding and preparing and making change, to changing behavior in the short term and continuing the behavior for at least 6 months. Falls are a growing danger. People with Parkinson's disease are at a high risk of falling related to postural instability, muscle rigidity, hypokinesia, which is slowness of movement, and altered gait patterns. Patients with PD have a 9 times greater risk of recurrent falls, and up to 65% of people will fall at least 1 time a year. Interaction of these factors often leads to fall-related injuries, hospitalizations, and increased fear of falling, limitation of activities, and decreased independence and quality of life. So let's learn the facts about falls. Falls are a serious threat to the health and well-being of a PWP. More than 1 out of 4 people 65 and older falls each year. And over 3 million are treated in emergency departments annually for falls injuries. Every 20 minutes, an older adult dies from a fall. 1 out of 5 falls causes a serious injury, such as a head trauma or a fracture. Medicare costs for fall injuries total over $31 billion annually. Hospital costs account for 2/3 of that total. Falls are common and falls are costly. So what are the risk factors for falls? Most falls are caused by the interaction of multiple risk factors. The more risks a person has, the greater their chances of falling. Through awareness and action, you can lower the risk by reducing the risk factors. According to the CDC's STEADY program, risk factors can be either intrinsic or extrinsic. Intrinsic is defined as something that is originating or due to causes or factors within the body. Intrinsic factors include advanced age, previous falls, muscle weakness, gait and balance problems, poor vision, postural hypotension, arthritis, dementia, and fear of falling. Extrinsic is defined as something that is not essential or inherent and is originating from the outside. Extrinsic factors include lack of stair handrails, poor stair design, lack of bathroom grab bars, dim lighting or glare, obstacles or tripping hazards, slippery or uneven surfaces, psychoactive medications, or improper use of an assistive device. The last segment is about your screening and assessments. Validated and current evaluation is the key to prevention and care for fall risk. Defining if you have fallen in the past year, you feel unsteady when standing or walking, and if you have fear of falling will help guide the direction of your care. In addition, understanding how well you perform specific functional assessments will define your ability to perform in terms of slowness of movement, loss of balance, stride length, arm swing, steadying yourself, shuffling, on-block turning, not using your assistive device properly, and lower limb strength. All right, we'll see you in the next section.